here at Chgoria Hospital. I'm also the program director of the Family Medicine Residency Program here at Chgoria. Since 2016, Chgoria has been teaching registrars how to become specialists in family medicine. While it's a relatively new specialty to the country, family medicine has been something that's been helping the worldwide population with reaching good quality care outside of the urban areas and into other areas where there is not easy access to all of the various specialties. So it's an incredible field that allows folks to treat not only many of the same conditions that a medicine doctor, a pediatrician, or an obstetrician or gynecologist would treat, but also does so with a perspective of holistic care, family integration, and perspective towards how to reintroduce good health practices into the home and into the community. Chgoria is so proud to be training family medicine residents because family medicine as a specialty is designed to meet the unique healthcare needs of a country like Kenya, other countries in the East African region, that really barriers to care, access to care is a real problem. So we find a way to train our docs to specialize in working through the various problems that afflict so many of our patients and populations around the world, to be able to do it with or without all the resources that you'd hope to find in the highest levels of hospitals everywhere in the world. What's unique about family medicine is that as specialists who are being trained in both medicine, pediatrics, and obstetrics and gynecology, is that our consultants get to integrate all of those fields into whatever health system they join, whatever community they work in and live in, whatever hospital they work in and live in. They can contribute to keeping the quality of care in all of those departments at and above the level that they're currently at and that you would hope to be able to give to your community. It's one of the great benefits of family medicine is that for the presence of one person, you're getting the training of three, largely in systems-based stuff. While there are, of course, limitations in the fullest extent, what you find is that family medicine can provide a vast majority of the services that all three of those can do. And when it comes to helping a hospital and a community make the difference for the majority of what they're struggling with in those areas, family medicine is being trained and equipped specifically to do those things. While, of course, referral to outside hospitals is going to happen, that's part of what family medicine is trained for as well, recognizing when there's true emergencies where someone needs to go into Nairobi for level 6 hospital care, and knowing what can be managed and treated at home in the home community for patients all across the country. And that way, families can stay together, patients can be more comfortable, cost can be controlled, and health solutions that can endure beyond that initial hospital visit can be considered and integrated into the care of those patients. I also want to represent the pediatric department here at Chgoria Hospital. Of course, what I want to do is introduce you to Anne, who is our head of department pediatrics, as well as our intern program director. She's an amazing asset, has been with us for the last 3 years and hopefully many years to come as she brings a level of care and quality of care to the pediatric services here at Chgoria that is inspiring to behold. We do nursery services where we manage a lot of complicated problems of brand new babies, as well as grade school children all the way up into adolescence. We have a daily pediatric outpatient clinic that meets and runs, and Anne is involved with as well as having all of those inpatient services. There's family medicine consultants that also get to work in that, and those are daily services that Chgoria is prepared to provide. We're looking at some pretty exciting stuff in terms of integrating a maternity and newborn expansion project so that the birthing experience and the care that can be delivered to moms as they're delivering and to babies as they're being born is going to be expanded in the near future. That's really exciting. That's a fun part of what we get to do here at the hospital is find areas where we can improve and to do it so for the benefit of our patients and our community, so that there's a safe and comfortable place for moms to come to deliver, and for kids who, of course, can be so distressed when they're ill, to be comfortable and to be receiving care in a context that makes them feel more at home.